Cervical esophageal cancer causes and treatment. Cervical esophageal cancer affects the upper esophagus. Smoking and heavy drinking are major risk factors for this condition. Treatment may involve chemotherapy, radiation therapy, surgery, or a combination. Cervical esophageal cancer is a type of cancer that begins in the upper esophagus, from the bottom of the throat to the indentation between the collarbones. According to a review in the journal Annals of Oncology, the condition is uncommon, making up 2 to 10% of esophageal cancers. This video discusses the symptoms, causes, and risk factors of esophageal cancer. It outlines how doctors treat cervical esophageal cancer and the outlook for people with this condition. Symptoms of cervical esophageal cancer. As cancer develops, it may start affecting bodily functions. The National Cancer Institute lists the following symptoms of cervical esophageal cancer: weight loss, pain or difficulty when swallowing, pain in the area behind the breastbone, indigestion, heartburn, hoarseness, a cough, a lump or growth under the skin. Research notes that a person may not experience symptoms in the early stages of the disease. Causes and risk factors. Scientists are unsure how genetic changes cause cervical esophageal cancer. All cancers arise due to genetic changes which cause cells to grow and divide abnormally. People can inherit these changes or acquire them during their lifetime. Although the genetic basis of cervical esophageal cancer remains unknown, scientists have identified several risk factors. These factors increase the risk of developing this cancer, although it is not inevitable. Cervical esophageal cancer risk factors include heavy alcohol consumption, tobacco use, high exposure to certain chemicals such as polycyclic aromatic hydrocarbons, human papillomavirus or HPV infection. Cervical esophageal cancer is more prevalent in certain parts of the world, including Iran, Central Asia, and northern China, suggesting that nutritional and environmental factors may play a role. Treatment. Several treatment options are available for those with cervical esophageal cancer, which doctors may recommend in combination. Radiation therapy. Radiation therapy uses radiation beams to kill cancer cells. A radiographer directs the radiation toward the tumor, aiming to avoid healthy cells. According to a 2018 review, radiation therapy can cure cervical esophageal cancer while maintaining good esophageal function. Chemotherapy. As a 2021 study explains, doctors can also use chemotherapy to treat cervical esophageal cancer. Chemotherapy uses medications that rapidly kill cancer cells to stop them from growing and multiplying. Surgery. Surgeons can remove tumors from the upper esophagus. According to a 2022 study, surgery alone improves the long-term survival of people with cervical esophageal cancer compared with combined chemotherapy and radiation therapy. The survival rate of cervical esophageal cancer is relatively low. An older 2016 review reports that if treatment is initially successful, the 2-year survival rate is 60%, meaning 60% of people will be alive 2 years after diagnosis. The 5-year survival rate is 40%. The same review reports that individuals may not survive longer than 20 months if treatment is unsuccessful. Cervical esophageal cancer begins in the upper esophagus and can cause various symptoms such as weight loss, indigestion, and coughing. It can also be asymptomatic until the later stages. Scientists do not know what causes this condition. Risk factors include smoking, alcohol consumption, chemical exposure, and human papillomavirus or HPV infection. Doctors use endoscopies, biopsies, and imaging scans to diagnose cervical esophageal cancer. People with cervical esophageal cancer may need surgery, chemotherapy, radiation therapy, or a combination of treatments. The outlook for cervical esophageal cancer is relatively low, as diagnosis may not happen until the cancer is advanced.